Hi there, my name is Dr. Kimberly Olson. I am a licensed psychologist as well as a licensed marriage and family therapist. I'm obviously an amateur when it comes to filming and recording and this whole YouTube thing, but one of the things that I had agreed to do was to do a video to discuss further the book that I have written. The book that I have written is called The Least You Should Know About Therapy, and it is designed for therapists. I have a great number of concerns about what's happening in our industry right now and the potential impact on clients and the profession overall. So I'd like to start by just reading you a bit of chapter one. We're not going to stay there forever. I know that you can read, but it's going to help lay a foundation. So number one, chapter one, introduction to problem. The client is a 55-year-old Caucasian female who requested therapy for depression from a telehealth program. The client was asked to complete a brief questionnaire before intake and indicated that she has an extensive history of therapy, but hasn't attended in 20 years. The client noted that she's currently experiencing a severe depressive episode and suicidal ideation, no plan or intent. The questionnaire also included demographic information, and the client indicated that she is married, has 2 children, and has been a school counselor for over 20 years. A therapist contacted the client and they agreed to meet via telehealth. They could not get connected due to a problem with the link, so they rescheduled for the following week. Feeling even more desperate and concerned about connecting this week, the client emailed the therapist asking, if for whatever reason we cannot connect this time, may we speak by phone? I really need to talk to someone. The therapist responded, we will be meeting by telehealth only. Feeling invalidated and frustrated, the client requested another provider willing to meet by phone. The second therapist contacted the client by email and requested that the client complete a goal-setting worksheet, something the client used to assist high school students in career planning before their first meeting. The client thought, you can't be serious. We haven't even met. Do you think a school counselor needs a lesson on goal setting? Nevertheless, based on the client's background as a school counselor, she responded to the email with the following. Let's discuss this, as well as our mutual expectations of therapy during our first session. This discussion never occurred. The first session went fairly well, despite different expectations of therapy. The therapist validated the client's emotions, and while never agreeing to use a thought record, the client found it beneficial, noting a core belief, I am alone. The client thought, it's good to have a different perspective, and I suspect I will learn a lot. The client was very enthusiastic. The truth is, by the time the client spoke with the second therapist, she was so desperate to be heard that she was willing to overlook any potential problems. It had been a pattern in the client's life to accept whatever scraps she was lucky enough to receive and worship the provider of said scraps. The client experienced ambivalence to the extent that she believed she was too needy and expecting too much, but also felt angry over not being asked for her input by the therapist. The second session went predictably wrong. The therapist had forgotten the thought record and the important core belief, which made the client feel invalidated and think, I'm not even important to a guy I'm paying to care for me. The client didn't say anything as she too understood what it was like to keep many students' stories straight. But more importantly, it would have been shameful to admit such vulnerability. The client redirected the emotions of this exchange to a significant issue of abuse that was deeply emotional and troubling. The therapist instructed the client to get a piece of paper because we're doing the wise mind exercise to teach you emotional regulation. The client was beside herself. The client tearfully said, this isn't going to work for me, and I need to end the call for today. I teach this too, but it's not what I need right now. The therapist said, okay, and ended the session. 5 minutes later, the therapist sent the client an email stating that the telehealth site had other therapists to choose from. The client hasn't been back to that site or any other therapist. Why? The American Psychological Association defines empathic failure as a lack of understanding of another person's feelings, perception, and thoughts. Arir adds, our emotional reactions or misjudgments as therapists result in us having a huge lapse in empathy and completely missing our clients. It is strongly suspected that neither therapist acted with malice or forethought, but reenacted damaging themes for the client instead of providing a corrective emotional experience. As the client shared these experiences with the author, she was struck by how frequently, especially in the past 15 years, she's heard this narrative. There were numerous examples of empathic failure in the vignette above. The client felt unimportant to the first therapist, as her pleas for an alternative contact method fell upon deaf ears. The second therapist failed to consider how goal-setting activity might be received from a well-educated school counselor or any client. The therapist did not follow up regarding the client's request to discuss expectations of therapy, which would have clarified this and minimized disappointed expectations. The therapist didn't review progress notes regarding the previous session, which had been powerful for the client. So what felt like a provisional bond was invalidated. The therapist did not respond to the client's distress, but instead attempted to implement an intervention that wasn't appropriate or well received in this case. The therapist did not respond to prompting to explore why the client ended the session early or provide an empathic response to the client's distress. Finally, the therapist provided referrals rather than reaching out to the client, which suggested termination and abandonment. The therapist's perspectives were likely to be quite different. The first therapist perhaps felt that the client was attempting to receive special treatment, and the therapist was setting a boundary. It could be that the first therapist wouldn't get paid if the session occurred outside of their network, so the therapist's reasonable concern about payment may have usurped the client's welfare. The second therapist may have thought that the client wouldn't dictate therapy when he was the expert. The client ending the session early may have been perceived as manipulation. The second therapist's insistence on certain activities may reflect anxiety over a lack of diversified training, discomfort with emotions, and or an inability to respond. It likely never occurred to either therapist that they were dealing with a truly desperate suicidal person. Due to pride, shame, and fear, her needs would not be met. The client delayed help seeking as long as possible. Months building up to seeking treatment had been riddled with tears, suicidal ideation, and desperation, although she kept this contained around others. When the client and first therapist experienced technical difficulties, the client was gracious towards the therapist, but privately cried and thought, I can't even get help when I pay for it. The client had not intended to terminate with a second therapist, but to regroup and find a way to communicate her needs while honoring his. The therapist terminated therapy or abandoned the client, which left the client feeling once again that her needs were too much and reinforced a core belief, I am alone. What if the client had committed suicide following these exchanges? Would the therapist be liable for malpractice? Probably not legally, but what about ethically, morally? Empathic failure is most commonly cited reason for premature termination. Being a clinic supervisor for 12 years, I have read well over 200 change of provider request forms. The majority of clients requesting a change of provider reported some version of feeling judged, invalidated, and or dismissed by the provider. Like the example of the school counselor, often the therapist's reaction to the client mirrors the client's experience with others, which may be due to eliciting maneuvers. While therapists are not mind readers, we should be trained to explore the dynamics that could predict empathic failure or the corrective emotional experience. It's unclear that this training is being done today. So I'm genuinely concerned about our profession, about our clients, and about what this means for people. There was a shift, and there's been many shifts in psychotherapy, of course, but psychodynamic therapies used to be dominant. And for better or worse, they are relationally based. They have kids like object relations theory and interpersonal theory. And those things have very much been vilified. It started off when we tried to sort of quantify or make scientific the changes that occur in therapy, which is next to impossible to do. Um, we would do comparison studies of things like behavioral interventions versus more dynamic interventions. And the truth is that if both of us went on a diet right now, and I was seeing somebody for a more dynamic therapy and modality, and you were seeing a behaviorist, and we measured our progress after a month, your progress would be profoundly greater than mine, right? Because think about the last time you went on a diet. You were probably on top of your game, right? It was being monitored, and you were probably able through sheer grit and willpower to sustain that for several weeks. Whereas if I'm over here talking with somebody about underlying causes, you're not going to see change for a while. Okay. That takes much more time. However, if we were to follow up and look at changes, you're much more likely to see long-term changes with a more dynamic modality. Okay. But that's not very pleasing to our industry. Our industry does the same thing as education. We do pendulum swings. Okay. Whereas we probably had many people wait too long. This is one part of the pendulum. Okay. Where everybody was getting therapy for 7 years and didn't need it. Right. And a lot of people who could have benefited from what we call today coaching or counseling were getting this long-term stuff that they really didn't need. Right. Fair enough. I'm with you all the way on that. But then that meant that instead of going to the middle and providing more long-term dynamic therapies to people who really needed it, people who had more characterological issues, people who had gone to counseling and despite knowing probably more than their therapist about what they needed to do, continued to be stuck. Okay, so therapy is sort of what you go to when counseling and coaching have failed. And I don't mean the program has failed. I mean that they're not able to reach you and what's going on for you. One of the things that we know about symptom relief and symptom treatment is it's a game of whack-a-mole. Okay. Some of you have seen that at the Chuck E. Cheese's where the mole pops up, you smash it down, right? But then another mole pops up over here and you smash it down, right? And so they just keep popping up. Okay. And that's what happens when we do only symptom relief for cases that need much more profound insight to understand what is the global problem that is creating all of these issues. So, for example, I could be drinking destructively and okay, there's the mole, right? And I go in and I get some really good behavior therapy and okay, I'm not drinking anymore. That feels great, man. That's terrific. But I never dealt with how come I got there to begin with. And so it pops up over here in compulsive overeating, or it pops up over here in being a workaholic. And so not getting to those core issues, as far as I'm concerned, is negligible. Okay. We can start there. We can start with symptom relief. Of course, I want everybody to feel better. Okay. We can, for people that are not experiencing sort of underlying pathology, by all means, go to coaching. I did coaching. I did counseling, but that's not what therapy is supposed to be. And yet we're all sort of getting lumped under the same umbrella. And my concern is that therapists are no longer being taught how to do therapy. In fact, if you ask therapists, new therapists in particular, what's the difference between counseling and therapy? They might likely tell you, I don't know, or very little, okay, which is frightening to me because there's a lot that's different between counseling and therapy. Counseling is intended to be very short term. It's problem solution focused, okay? And the counselor is the expert. Okay. This is the person that's giving directions. This is the person that has all the answers for that person. And it's a good thing. Okay, there are several sorts of issues in life where you need a short-term solution. All right. Think about substance abuse or domestic violence. You may not be alive long enough if those things are not treated immediately with very directive approaches. Okay. Um, we need for you to stay alive long enough to get to the other reasons, right? To get to the deeper underlying concerns. Um, and again, if you don't need to, if you can work through your symptoms and life stays peachy, awesome. You don't need therapy. You benefited from counseling. That's wonderful. But again, what happens when, okay, you've gone to the University of YouTube? Okay, you probably know more about your mental illness or relationship issues than most therapists do. Okay. Um, but you keep sabotaging yourself. You keep setting yourself up. Your gains are short-lived at best. Okay. And that hole in the gut, that pain, that visceral pain remains there. It's just not decorated and flowered over with bullshit. Okay. When that's still there, then you probably need to go see a therapist. A therapist is supposed to be the one that deals with that stuff. Okay. That's why you have to go to school forever and ever. You have to be able to work with relationship patterns and not so much the what of what somebody is doing, but the why. So let me give you an example from the book. Just a little bit of scrolling here, guys. Let's start off with a simplistic example. Carla is a 30-year-old Caucasian female who comes to therapy for depression because I can't keep a man. Carla reports that her father left when she was 6 years old and never returned. Carla has experienced 3 significant romantic relationships, one in high school, another in college, and a marriage that resulted in divorce. Carla tearfully and sincerely asked, "Why do they all leave me? What's wrong with me?" Upon asking clarifying questions about the dissolution of these relationships, the therapist can filter through justifications, emotionalism, and a lack of self-awareness to discover the following eliciting maneuvers that predicted abandonment. Carla cheated on her boyfriend in high school. Her boyfriend in college was married, and her ex-husband had been married 4 times before. So when you look at the surface of this issue, okay, when our Carla comes in, she's probably going to be aware that her dad left and that really hurt. Okay. She's also going to be aware that all these guys she's had in her life leave. And she's probably going to tell you that men are miserable and that they all leave. Okay. And not have any recognition of what she does that can predict that these guys are going to leave. Okay, that's the eliciting maneuver. That's what we do to get people to behave in a predictable way. So let me just state up front, this is not victim blaming. Okay. If I become aggressive with you, it may be designed to shut you down. Okay. And it may, in fact, I may not understand why you don't want to talk to me about deeper issues because I don't get that my aggression elicits a shutdown. Okay, the same is true here. So we look at her listening maneuver. She cheated on the boyfriend in high school. The boyfriend in college was married, and she has 4 prior marriages. Okay, none of them lasting more than 6 months. So based on her experiences, her pathogenic belief, or what keeps us all going, is that all men leave. Okay, and her core belief is that I'm unlovable. Okay, her core belief is what all this says about you. And human beings maneuver this way. So how does this impact therapy? Let's take the example of Carl. Carl is a 40-year-old African-American male who came to therapy at the insistence of his new wife, Katie. Carl reported feeling angry and depressed as his children from marriage number 2 are often mean to Katie when they visit. Carl and Katie met at work. and this relationship appears to have factored into the divorce. But Carl is reluctant to acknowledge this. Carl's therapist is a 40-year-old divorced Latina, raising two children independently. As she listens to Carl's upset over the children's rejection of wife number 3, she can't help but think everything is about him. He doesn't seem to empathize with his former wife or their kids. What about the kids' feelings? Being a self-aware therapist, she could recognize countertransference, and her interpretation was not verbalized. The therapist instead stated, I can certainly see that this is impacting you. I'm wondering how you think the children might be experiencing this. Carl became defensive, although he didn't know why. Carl responded, I'm sorry, but I'm not one of those liberal parents who lets the kids run the show. The therapist thinks, so now I'm a touchy-feely liberal for caring about your kids' feelings. Oh, I forgot it's all about you. While the therapist is not overtly stating her feelings, the tension in the air is thick. So without appropriate intervention, Carl's not going to return to therapy, because he's going to feel judged and invalidated. And the therapist may secretly feel relieved. She's not going to have to deal with this narcissistic guy. Okay. So what if the therapist took the time to know the client's internal working model before making assumptions? Okay. And you can do this by using the relational chart. So let's go down to the third paragraph. Through completing a relational chart and intake, Carl's therapist discovered the following. Carl's a 40-year-old African-American male who came to therapy at the assistance of his wife, Katie. Carl reported being raised in a large urban city by his mother. His father was in and out of prison his entire life. Carl stated that his mother remarried when he was 14 years of age. Carl and the stepfather did not get along, so Carl reported sofa surfing until he was 18 years old and joined the military. Carl has been married 3 times and has 6 children, 3 with wife number 1, 2 with wife number 2, and 1 in his current marriage. Carl stated that he first met his wife while stationed overseas, and she and the 3 children still live overseas, so he rarely sees them. Marriage number 2 ended with many animosities, as infidelity with Carl's current wife was a factor in the divorce. Carl stated that he has a hard time visiting with his children with wife number 2, as they are unkind to Katie, and if things don't change, he will end visits altogether. Katie is concerned about Carl's depression regarding the visit. So let's place this information into the relational chart. So we learned that father wasn't in his life consistently. Mom abandoned the client and chose the stepfather over him. The pattern, client is not involved with children from his first marriage. Client is threatening to abandon children from marriage number 2 over the stepmother. His soliciting maneuvers, married someone who lives overseas. Infidelity and abandonment of family number 2. Lacking in empathy for the children's perspective. His pathogenic beliefs can be anything like fathers are unimportant, the feelings of children are unimportant, and parenting is optional. So what does this say about me? My feelings were unimportant to both my mother and my father. Maybe I'm unimportant and unlovable. So let's take a look at the therapist who now has taken the time to get to know her client well enough, okay, to understand what's going on, what's moving him. So we look at Carl is a 40-year-old African-American male who came to therapy at the assistance of his new wife, Katie. Carl reported feeling angry and depressed, as his children from marriage number 2 are often mean to Katie when they visit. Carl and Katie met at work, and this relationship factored into the divorce. Carl's therapist is a 40-year-old divorced Latina raising 2 children independently. As she listens to Carl's upset over the children's rejection over wife number 3, she can't help but think everything is about him. He doesn't seem to empathize with his former wife or their kids. But this makes perfect sense based on his background. It seems that he's invalidating the kids the same way he was invalidated. Being an insightful therapist, she understands that if she can get Carl in touch with his invalidated pain, and provide a corrective emotional experience through validating his pain, he will likely be able to do the same thing for his children. Therapist states, Carl, as I'm listening to your frustration over the relationship between your kids and Katie, I couldn't help but wonder what it must have been like to be a 14-year-old boy, sofa surfing because he didn't get along with his stepfather. A basic understanding of the client's internal working model changed therapy from combative to compassionate and problem-centered to person-centered. At this point, I suspect there's going to be at least one therapist who's watching this video. Why do I need to know all this? Couldn't I address the visitation issues? Come on now. Focus on exceptions to the negative visits and build upon those exceptions? No. Look at what happened in the first exchange with the therapist when she only addressed the symptoms. The underlying relational dynamics destroyed any real possibility of change. Okay. Regardless of your orientation, you need to understand relational dynamics enough to overcome any interference with your therapy goals. Okay. Now, let me be the first to say that not everybody can do that. It requires something called insight. Insight is being able to recognize the gray. It's being able to connect dots. And it requires a baseline of intelligence that not everybody has, just to be candid. Okay? And it used to be the case that admission to therapy programs, and usually master's or doctorate level therapy programs, were incredibly rigid. Okay, you had to go through interviews. Oftentimes, you had to have published. You have to have demonstrated a real significant dedication to the profession and what we're doing. Now, there were some downsides to this admission process because a lot of people with terrific real world experience got sort of ex-nayed from that process. Okay, we don't want that either, right? We don't want to do the pendulum swing. Okay. Unfortunately, when these programs opened up, when education really opened up, we seem to go for the quickest, least meaningful way to educate people because that's what the consumer wants, you see. Okay. Everybody wants to have the master's degree, but not everybody wants to work for it. I'm not sure who first said this, but everybody wants a degree, but not necessarily an education. So we go from programs where folks were meeting on campus 3 times a week for the bulk of the day, okay, doing their homework in between and working in some sort of community counseling center where mentors were filming them and watching them to see what kind of sort of patterns of therapeutic interventions that were not effective, things of that nature, to meeting 4 hours a week, sometimes just online. Please tell me how you can help somebody become a better therapist online. You don't get to see them role playing. You don't get to notice their patterns of interactions with others, certainly not to the extent that you would face to face or even on Zoom. Okay. And the standards, it's baffling. Okay. Therapy is not something that you can just pick up out of the trash can and do it. It requires a hell of a lot of training. It requires self-reflection. Oh my God, which we'll get to more in a bit. It requires a dedication. And if you want to be a good therapist, it can't be the second or third priority in your life, right behind your job and your kids. Okay. I'm sorry, I don't mean to be the controversial person, but you get what you give. And if you're spending 4 hours a week doing minimal amounts of homework to get your quote unquote training, that's not enough. Okay. In this profession, we're given free rein around people's Gullivers or their minds. Okay. The baseline expectation of training should be profoundly higher than it is. Okay. And again, this is fairly recent, and it really came when, well, there's all sorts of political and social reasons that it came about. But, all you need really is a student loan these days. And you can go to one of those programs. Okay. Um, and it's just unfortunate. Okay. Then you have students who complain because you're asking them to go above and beyond. And my question always is, don't you care? What you're doing right now is you're training to work with people's pain and vulnerability. Don't you care? Or it's just about you getting through it, about your ego and your belief that you can already do therapy. Okay. Because again, I don't blame people for not understanding it. Okay. Everybody can do counseling. All you need is a list of skills and I can facilitate them with you. But that's not therapy. And unfortunately, again, if you're going for a degree where so little time is spent on your education and going through your interpersonal stuff that is going to impact the way that you treat people, okay, the outcome's not going to be good. And we owe the clients better than that. We owe the industry better than that. But there are so many catch-22s going on in our industry right now. Something really interesting. I was having breakfast with a girlfriend yesterday, and she told me that her therapist asked her to rate her on Yelp. Are you kidding me? Therapy is supposed to be an intimate relationship. Okay. Me and you. And if I am doing my job worth anything, you're going to not like me sometimes. Okay. Because if you walk away from your therapy session always being overjoyed and loved by your therapist, they're not doing their job. Our job isn't to be liked, it's to be effective. Fortunately, the two often go hand in hand, but not always. And some of the most compelling sessions I've had with people were mad. God, they were angry with me. Okay. And some of them didn't come back next week. Sometimes it took 2 weeks to come back. They're like, yes, I was really mad at you, but it ended up being true. That's my job. Okay. And so if you have to give me stars after I'm doing your therapy, gross. It's not a popularity contest. It is about helping people change their lives. And again, if you're doing your job worth anything at all, there's going to be times your clients don't like you. Okay. But make no mistake, the industry has got therapists over the barrel on many occasions. When I was in private practice, I was contracted out for one agency in particular, and the clients had to do these little surveys after each session. And again, it's like the Yelp rating. Okay. If we've had a really good session, I may get 5 stars. But then again, if that made you really mad because we talked about really painful stuff that you don't want to talk about, but it's messing up your family, so we need to. Okay. I may end with 1 star. And so therapists have become overly concerned now with making sure they are liked. That's not your job. Your job isn't to be liked, it's to be effective. And so it's unfortunate that we're going in that direction. So we've got number one, a lack of training, which you can understand if the person's only going to school 4 hours a week. Okay. How are you going to begin to teach very complex, multifaceted concepts? You're not. You're going to go as concrete as humanly possible. Okay. Because there's a minimal amount of time and effort being utilized to do this. Then you have the insurance companies who are now doing this with they're calling evidence-based practices. But again, I really hesitate to accept that definition. Okay. Because as anyone who's ever done research knows, a lot of it has to do with what you measure, when you measure it, and dare I say what you're looking at post hoc. Okay. And if I'm an HMO that's very invested, okay, in keeping my costs down, and I'm also funding the research, could there be a conflict of interest, Golly Gee Wally? Okay. And this is not to suggest, by the way, that a lot of the most popular modalities right now aren't wonderful. They are. I love me some DBT. Hello, bring me some mindfulness. They're wonderful, wonderful, but they do not usurp the fact that if you do not have a grasp of the therapeutic relationship, your client's not going to stick around long enough to get those wonderful interventions from you. If a client doesn't feel loved and cared for by you, okay, and you put a piece of paper in front of them, okay, that's not what therapy was intended to be. See, the corrective emotional experience is supposed to be different for each and every person. And again, that requires a degree of insight. So let's say that I'm a very intellectual person. Okay. I don't want to be in touch with my feelings. I don't want any part of that. But what I want instead is I want to get over this problem. Okay. So I go into a therapist. We start working together, and I come in with, like, bar graphs and charts and things because I'm a very organized intellectual person. And the therapist, who may or may not be of like mind, okay, completely misses what the person needs. In this case, if you've got somebody who's very intellectual and rationalizes everything, you need to help them get in touch with their emotions. Okay, that's where their growth is stunted. They don't need more of the same. They need something different. On the other hand, if you've got a client who's been led their whole life by their emotions, that they think their emotions are real, and they make all their decisions based on their emotionalism, then you probably need to be practicing a much more cognitive approach with your client. Okay, so that's the corrective emotional experience. It's going to be different for everybody. If when I get scared as the client, I get very challenging and evocative, and you respond to me by either being harsh or doing nothing, okay, because you're not here to be a doormat either. That's not corrective. And you have no grasp of why they're behaving this way. You do not have the capacity to provide a corrective emotional experience. You don't. And it requires heart, and it requires truth, and it requires guts, and it requires a willingness for you to look at your own stuff. So let's take a peek. A big portion of this book is dedicated to you. Because for every transference, baby, there's countertransference. And it's up to us as the therapist to be mindful. Okay. So let's go down. I'm going to go to the questions first, because I think this is where a lot of people got lost. Sorry about the pause. Okay. All right. So we'll take this apart step by step. And as you can see, when you're looking at these items, please, by the way, take the time to write answers to it. Okay. I didn't space it this way so the book would have more pages. I spaced it this way so you'd write in it. So what city and state did you grow up in? Okay, that's very non-threatening for most people. As a child, did you feel safe in your neighborhood? Were there other children to play with? Describe your experiences with the church. What was your socioeconomic status? How did you know your mom was angry, sad? Okay, so you're going to be answering these questions and utilizing the key. You're going to end up putting it into the chart. And the reason I use the chart is that it's really easy to make connections. Okay, when you got it right there in front of you. So, for example, the template, person lived in Bayfield, Maine from 0 to 12. They were able to have safe, independent play. They lived in Walter, Nevada from 12 years on, middle class. Parents married, 50 years, and they are an oldest child. That's their demographic template that tells us how they grew up. Female authority figure, which is usually mom, okay? How she dealt with anger was by yelling, crying, overeating, demeaning. It was important for her to win. When she was sad, she would overeat, cry, and isolate. Joy, she was a neighborhood mom, creative, funny. She did work, but she got fired a lot and competed. Dad's loyalty, even when she was wrong, and appearances were important. So your male authority figure, your dad, is a peacemaker with mom, even at the expense of at the children's expense. Sad, isolates. Joy, listener. He likes to be outdoors, gets along with everyone, dedicated worker. Loved but unclear about the respect for his spouse, and failure to protect his children. So that's the relationship with dad. And all of these things came out of those questions in the back. And there's a key in the back, so you know where to put things. Peers, brother was talented, athletic, likable, popular, extended family preference, poor academics, told my secrets, unsupportive, victim posturing, friends, exclusivity, one best friend, some betrayal, but some positive and supportive. Okay, so we go down to culture, and I'm not going to go through all of these. Okay. Then you go on to fill out the handouts regarding the pattern. Okay, and what do we begin to see in the pattern? Well, let's take it up here. It might help make it a little bit more clear. Okay, so in the pattern, we discover that this person still lives in Walter, Nevada. They feel safe, but they're isolated. A little independent play, upper middle class, married for 22 years, 2 moves within the city. What you're going to do is begin to underline the similarities. Okay, so you can see in this person's case that they stay in one town for a long time. They felt safe. Okay, middle class to upper middle class, a common transition. Parents married 50 years. Client married 22 years, which means that they're both vested in long-term relationships. Okay, so we remember our template for mom, which was she was a yeller, she overate, sad, she would isolate. She was also the neighborhood mom. She worked, but she got fired a lot, and there was competition for dad's loyalty. Okay, female authority figure says this person grew up, and this all comes from the questions in the back. With teachers, she felt loving, special, fair, but sometimes humiliation. Bosses overall loving and fair, but occasionally competitive, undermining, feeling misjudged and helpless. Work, this person's a hero, hardworking and dedicated. So I want you to think about this idea. Well, let's go with the mom template at this point. So if you have a mom who's very competitive, okay, what's your assumption going to be about women in authority? And how might that impact your listening maneuvers, which is the next step? So we saw the patterns here, okay, between the template and the pattern. Now, this is the eliciting maneuver, how we get people to behave in a predictable way. Well, if we take demographics, person went to college and has 2 jobs, so they're going to be upper middle class. Husband is employed, stayed in Walter for the family, upper middle class, and stayed married. So all of these things can predict that you're going to have this lifestyle. Okay, as we said before, we've got the mom who could be competitive and demeaning. And so we've got a woman who is suspicious, right, of female bosses, because anytime a woman starts to present with some of those characteristics, right, their hackles are going to go up, right? So female authority figures, what is their listening maneuver? She treats them like they're guilty until proven innocent. Okay, not consciously, okay, but feels reluctant, frightened, has to take a lot of time to sort of measure and figure out what's really going on with them. What are their motives? Anxious, defensive, and afraid, right? And so if you're anxious, defensive, and afraid with someone, what's their response going to be to you? Okay, they're going to return in kind. I must prove myself. Hypervigilant invalidation. So anything that could be interpreted as invalidation will be. Helpless and dismayed, or arrogant and defensive. Okay, so how are people going to respond to somebody who's arrogant and defensive? And a dichotomous classification, perfect mother or monster. All right, so guys, how does this impact your beliefs? So let's stay with the female authority figure. My beliefs about women, based on the pattern and the template, could be that they're not trustworthy until proven to be. I'm helpless and you will bury me. If you feel threatened, you are either the perfect mother or a monster. Okay. So those beliefs keep this pattern going. So it kind of sounds like this person has had some corrective emotional experiences and doesn't necessarily view all women as monsters, but you still got to prove yourself, which again, a lot of people are going to resent because they don't understand. And then finally, your core beliefs. So if female authority are not trustworthy, that you have to prove yourself, that you're going to be helpless if they feel threatened by you, okay? What do you believe about yourself? Because again, this is primal. This goes back to mom. You don't deserve success because it makes others feel like less of a person. Okay. So if on a very deep kernel level, I don't believe that I deserve success, all of these other things, okay, are going to be smoke and mirrors. Okay. And so as therapists, we get this amazing opportunity to really get to know what's moving a person. And if you address what's really moving that person, and you can begin to, using CBT or whatever, I like the thought challenging that goes on in CBT, to challenge those pathogenic beliefs, to challenge those core beliefs, you can move some mountains, okay? But not if the client doesn't feel understood first. I mean, don't you hate it when you give somebody very little information and they act as if they know everything about you? You know, okay? And often what people claim to come to therapy for isn't really why they're there at all. When I was in private practice, everybody would say, when you get the phone call, I'm having communication issues. Okay. Well, they didn't know me from Adam, so they're not going to come in and tell me they're there for bulimia right away. They're going to often come in for other reasons. Okay. Stuff that's more acceptable or seems more acceptable. And it is only through establishing trust and finding out what's motivating this person that we're ever going to get anywhere. And guys, it's really important for us to know these things about ourselves because we get triggered. And when we get triggered, we make mistakes. Yeah. Sometimes big mistakes. See, if you've got a client who's challenging your credentials on a surface level, okay, they're being a total butthead. I get it. I get why you're irritated. But you're feeling particularly insecure that day. And let's say you have a narcissist in your background, okay, that spent their life judging you and making you feel bad about yourself and demeaned, right? You get defensive, okay? And of course, the client's reaction has nothing to do with you, not in this case anyway. Okay? They're feeling threatened. What do I do with somebody when I'm feeling threatened? I challenge their credentials and it shuts them down and stops that conversation. Okay. So of course it'll be a process comment that is appropriate in those cases. So I noticed that as soon as I asked you about your father, okay, you began asking me about my credentials. What do you think that might be about? But you got to know yourself. Okay. And if you don't want to go there, then don't. Okay. There is a multi-million-dollar industry in coaching and in counseling, and it's a wonderful thing. Wonderful thing. I refer clients to counseling, especially if they've got substance abuse issues and things. So there's some really good stuff going on out there. But don't be a therapist unless you want to be a therapist, because you're going to hurt people. Humility is needed to be a good therapist. And if you walk in thinking that you have all the answers, that you couldn't possibly be impacted by countertransference, that I keep my biases in check, you're full of it. You're lying to yourself, and it's going to hurt people. So what I'm going to ask is, when you're reading this book, to really examine you and also examine clients that maybe you've had for a while. Are you in a position where you are recognizing their patterns? Are you in a position where you're able to challenge those beliefs that go back to the beginning, but nevertheless impact the client like it was yesterday? Okay. To really begin to do your work. Our profession is supposed to be special and unique, and what we offer is supposed to be something that is unique, that not everybody can do, that not everybody has the insight to do, okay? Or the fortitude. I mean, who knows? So yeah, if you want to be a coach, be a coach. If you want to be a counselor, be a counselor. But if you want to be a therapist, please understand that your obligation to clients goes well beyond what a lot of you have been trained in, what a lot of you are willing to do. Okay. But I choose to believe in the best in most people. I think a lot of it has to do with training, and the other part is that you can't give anybody something that you haven't received. I can't take you on a journey that I haven't been on. Okay? So I thank you from the bottom of my heart for all your service that you're doing out there, whether you're a social worker, or a counselor, or a coach, or a therapist. These are all wonderful acts of service, and I thank you. And my hope is that you got something meaningful out of this. So thank you.